Our first speaker today is Sophie. Sophie has already spoken to us about the importance of organ donation and the relationship she shares with her sister. We've also learned a couple of personal things about her, like her lack of tolerance for slow walkers in the hallway, and her opinion about the traditional 5-day school week. Today, Sophie will be speaking about obsessive-compulsive disorder. In 6th grade, she watched a show about OCD and has been fascinated with the topic ever since. Everyone, please welcome Sophie Van Serksen.
Think of all the students in our grade. According to the percentage given by the International OCD Foundation, copyrighted in 2012, 2 people in our grade are affected by this disorder. Since obsessive-compulsive disorder, also known as OCD, is a serious anxiety disorder that more and more people are developing, we should have a full understanding of OCD. In the next few minutes, we will learn more about what the disorder is, the causes of it, the conditions, or the causes of it, and the treatments. OCD is a complicated condition. According to the Mayo Clinic website, last updated on December 15, 2012, OCD characterized by unreasonable thoughts, fears, and obsessions. These obsessions cause a person to do repetitive behaviors they feel compelled to perform. A person may not wash their hands once, but 6 times in 10 minutes because they're afraid of germs on their skin. As found on healthguide.org, a website that informs people about health challenges, on April 2012, most people with obsessive-compulsive disorder fall into one of the 5 categories. A person with OCD may be considered a washer, who is a person who is afraid of contamination. There are also checkers, who routinely check things like making sure the oven is off or the door is locked. Also stated by the aforementioned, doubters and sinners. Doubters and sinners are afraid that if everything isn't perfect, terrible things will happen. Counters and arrangers are obsessed with order and symmetry. A hoarder is a person who feels that they have to keep all these different things to make sure that everything is safe. So these are the 5 categories of a person with OCD could fall into. OCD may be easy to identify, but many people do not know about the causes of the conditions. There has been a good deal of research on the causes of OCD. As stated in anxietycare.org, website sponsored by Anxiety Health Federation, copyrighted in 2013, OCD may be caused by a lack of serotonin in the brain. As said by kidshealth.org, in an article published on September 2012, when the flow of serotonin is blocked, the brain is not able to filter out unnecessary thoughts, so instead the mind dwells on these thoughts. Anxietycare.org went on to say that OCD is considered to be somewhat genetic. Many people with OCD have family members that also have OCD or other anxiety disorders characterized by these levels of serotonin in the brain. It is because of this that scientists believe that the tendency for someone to develop an imbalance of serotonin can be inherited through genes. The causes of OCD has led experts to develop treatments for this anxiety disorder. OCD can be difficult to treat, and it may not always result in a cure, but there are a couple ways to reduce the symptoms. As stated by NIMH.gov, which stands for National Institute of Mental Health, copyrighted in 2012, a special type of psychotherapy called cognitive behavior therapy is especially useful for treating OCD. This type of therapy teaches a person different ways of behaving and reacting to situations. As stated by the aforementioned, during this cognitive therapy session, a person may be exposed to the source of their obsession and their act to not act compulsively. So let's say you're a compulsive hand washer, you may be asked to touch a public door handle and refrain from washing your hands. Mayo Clinic said that a person with OCD will need more than just therapy. They will also need medication. The most commonly prescribed medications for OCD are anti-anxiety medications and antidepressants. These have proved to be helpful because people with OCD, it helps decrease the levels of serotonin. Now that you know more about OCD, the causes of it and the treatments, you can see that this disorder is actually quite complex. Because OCD is becoming more common, it is important to have a full understanding of the condition. There is a very probable chance that you may run into a person with OCD in your lifetime, whether it's your future coworker, your college roommate, or perhaps the person you're sitting next to right now.